We would like to believe that it is a fat busting therapy, but it is actually an anti-diabetic drug. Semaglutide is a prescription drug and it should be used only when the doctor thinks it should be taken. It should not be a choice of the person who wants to lose weight.
Hi guys, this is Mini Divan and you're watching HealthSite and India.com. Today we have with us Dr. Sharad Sharma, consultant, laparoscopic and bariatric surgery, Fortis Hiranandani Hospital. Hi doctor, how are you?
Hello, I'm good.
Good to see you.
Tell me, what do you have for me today? Yeah.
I think, the topic for today is the much talked about topic. Everyone is really gushing about this. Thousands of obese UK residents would be offered a weekly fat busting injection to help shed weight. Now, this is something which is very, peculiarly new because, it's a weekly process suddenly. And the treatment is called I don't know if I'm pronouncing it right. Please correct me if I'm wrong. But the treatment is called semaglutide. So, what is this exactly? What's the process like? If you can really enlighten our audience a bit.
Right. So, number one, let us get the whole thing in perspective. It is not something called a fat busting therapy. Okay, because we would like to believe that it is a fat busting therapy, but it is actually an anti-diabetic drug. Okay, so one thing I tell you is that everything that we use for fat busting is off-label. Okay, most of the drugs today, 9 out of 10 drugs are off-label drugs. So they are basically, when they are produced for a different reason. And we realize as we use those drugs, we realize that they have side effects of weight loss. And that is the reason why they start being used, we start using them for reducing weight. So semaglutide is actually a GLP-1 agonist. Okay, so GLP-1 is a gut hormone which is produced in the human body, in the intestine. Now, this is a natural process. So whenever a person eats the GLP-1 glucagon-like peptide, it increases. When the glucagon-like peptide increases, you start feeling less hungry. So suppose it's like this. When I eat food, I feel as if I have eaten enough food, isn't it? At some point of time, you feel full. Now that is the function of GLP-1, which is inside your body, which is naturally produced. Now what we started doing is we started producing this GLP-1 like substances. So when we say agonist means they are like those substances. So we started producing substances like GLP-1, which started having similar effects. Now, also GLP-1 agonists are there since last 15 years. So this is not a new drug, but initially when we started using GLP-1 agonists, they had to be injected on a daily basis. So one of the first drugs which were used was Victoza. So I'm sure people who are looking into this and reading about it on a daily basis, Victoza was called liraglutide. So liraglutide was one of the first GLP-1 agonists which was used, and it had to be used in smaller doses. So you have to keep increasing. Now, the difference is that when you use them for diabetes, they have to be used in large quantities. The dosage is much higher. So let us come to semaglutide. Now, what happened with semaglutide is as we kept progressing from one drug to the other, we came with semaglutide, which was a once a week dosage. Now, once a week dosage is a big relief to people who want to use this drug. So it comes in 3 doses, like 3 strengths. So the anti-diabetic strength is 7 milligram and 12 milligram, of rather 14 milligram. And the dosage used for weight loss is 3 milligram. Pretty less. So that is how it is. Now, actually, the news that was shared with me, now the drug has progressed to an oral medication. So from an injectable, it has been launched in India by Novo Nordisk. It is again by the name of semaglutide, but the drug name is different. It is called Ribelsus. So it's an oral drug. And the one that you are describing is called Ozempic. So the injectable semaglutide is Ozempic, and it will actually get phased out very fast because the oral one has already been launched in the market, and both are by the same company.
So help me understand here, if it is, correlated to diabetes, can only diabetic patients use this particular drug?
So that's what I said, that the FDA used the actual function of this drug is to control diabetes.
Yeah. But since it's being used for fat reduction as well, is it just being used only on the patients who are perhaps diabetic, or it can be used on
ideally yes. So ideally, if a person is diabetic and obese, this will work well. But the thing is that we must understand that we are talking of only certain class of obesity. So we have obesity which can be less severe and more severe. So we divide it like this. Less obese are overweight, then obesity class 1, class 2 and class 3. So this drug is good for diabetics with obesity class 1 up to obesity class 1.
But in that case, doctor, is it really effective? Because there's a pattern now, weekly injections, right? A, why weekly? B, is it really, will it reap any sort of benefits to individuals?
Yeah, so it is not something which will work forever.
Okay.
So it is a drug which can be used. If it does not give good results within first 2 months, we have to stop the drug. So not everybody benefits out of it, and there can be side effects. So you can have nausea, vomiting, diarrhea, headaches. There are a lot of side effects. There can be hypoglycemia to certain patients. So if you are not tolerating the drug well, then you may not be able to take it. But if two things, if you have tolerated the drug well and you have seen about, if the drug is effective in the first month and a person does not have much reaction or tolerance issues with the medications, then that person can continue the medications for next 6 months. And we see that you can lose up to 10 to 20% of the excess weight. And that is the maximum weight loss that we see with these drugs.
But in that case, doctor, there has been a lot of apprehensions with respect to whether one should really even think about it or not. In your personal opinion, what do you think? Like, should people go for it or not? Because there are other methods, liposuction, there's so many things, in terms of this particular domain, fat reduction. So is there a need to particularly think about this new pen injected version?
So number one, weight loss and maintenance. So weight loss is one part, maintenance of weight loss is another part, and the best and the first and the foremost, which will always remain the number one priority, is lifestyle modification. So I can take, any drug, it may be a semaglutide or any other medication, whatever you do, will work only if I have control over my calories and expenditure of calories. So there can be no other substitute to that. So what we are doing by these medications, so a person says, I am exercising a lot, I am taking care of my diet very well, but still I am not able to do it. It is at that point of time that the person requires assistance. So you must understand that first you have to achieve an optimal lifestyle. Then you think of other methods. Okay, so that is what it is. Now, secondly, we don't need to take semaglutide right away. And semaglutide is a prescription drug which the doctor decides. It should not be a choice of the person who wants to lose weight. So there are a lot of safe drugs which have been used over last 10 to 20 years, like orlistat, topiramate, and metformin. So there are these drugs. Again, metformin is an anti-diabetic drug which also has, it's a very old anti-diabetic drug which also has weight loss properties. So all these medications should first be tried before shifting to semaglutide. And mind you, semaglutide is an expensive medication. Now, 1 month dose might be costing around 20 to 25,000 rupees. So try to understand, this therapy doesn't come cheap. So if you have to take semaglutide for a period of 6 months, you're going to end up spending something like 3 lakh rupees.
Well, I think that's really something that one needs to be alarmed of. Any other advice or any other tips for all the viewers who are listening in today?
Yeah, so weight loss is a real problem as of today. I think India, and if you do not know, India is number 3 in the list of obese patients population, and we should seriously think of obesity as a disease in India. We should all take care of ourselves. We should all, at foremost, we should take care of our lifestyle. We should have a healthy lifestyle and eating habits.
Well, Doctor, this has been very, very insightful. So thank you so much for joining us today and bursting all the myths with regards to the fat busting injection. So thank you.
Thank you very much for having me here. Thanks a lot.